Here at the Gulf Coast Cancer Centers in Daphne, we're speaking with Dr. Hickson today about a very serious medical condition that is prostate cancer. Prostate cancer is an interesting medical condition because there are more and more cases every year. The silver lining, however, is that there is more and more advanced treatment. Dr. Hickson, can you give us a little bit of background into prostate cancer?
Prostate cancer is the #1 cancer in men. There's about 233,000 cases of prostate cancer every year, and there are about 30,000 deaths every year from prostate cancer. That's the #2 cause of cancer death in men. The survival for prostate cancer is remarkably high. The 5-year survival for men that are diagnosed with localized prostate cancer or even regionally spread prostate cancer is 100%. And for those that have distant spread to other parts of the body, the 5-year survival is only about 25%. So the importance of screening cannot be underestimated.
So one of the most important things for men to do then is a PSA screening. Tell us about that PSA screening. What is the process like?
Well, screening for prostate cancer generally consists of both a prostate examination by a physician and also a PSA. And there have been some recent studies that have come out that question the utility of prostate cancer screening, and some of the recommendations I think have been misinterpreted within the media. The recommendations have been against routine screening for prostate cancer. That doesn't mean that no one should have it. It just means that we should be careful and consider who we screen and who we don't. But I think that the interpretation has been, oh, no screening is needed at all, and that's not the case. And all of the major institutions or groups like the American Cancer Society, National Comprehensive Cancer Network, and also the American Urological Association, they do recommend screening after the doctor and the patient have a conversation about whether it's reasonable or not to do that. So it's not that those people don't recommend it, they're just saying have that conversation first, share decision making, and then you proceed from there.
We mentioned continued advancements in technology. One of those is Calypso technology.
Calypso technology is a technology that is relatively new. It's a technology that we use to help guide our radiation treatments for prostate cancer. When we give radiation treatments, the treatments themselves are extremely focused and allow us to spare those adjacent organs next to the prostate. But during a treatment, the prostate can move, and the Calypso, also called GPS for the body technology, will allow us to not only localize the prostate and make sure it's in the right place, but make sure that it stays in the right place for the entire course of the treatment.
So then I guess the main thing that we want you to take away from this interview today is that have the conversation with your physician. Don't buy into the hype about the controversy over whether you should be screened or not. Simply talk to your physician about it and find out if it's right for you. It could mean the difference between life and death. Dr. Hickson, thank you so much for joining us on Studio 10.
Joe, thank you very much. I appreciate your time.